Hello, and welcome to Afternoons with Ashley. I am stoked to be with you guys today to talk about some of the ads that you may have seen from Unity Public Health Department in our Discover Muscatine newspaper about testing. And I have our expert here with me today, Miss Jamie McLean. And so, talk to us a little bit about what your position is so they know who you are at Public Health. And hello, and welcome to Afternoons with Ashley. I am stoked to be with you guys today to talk about some of the ads that you may have seen from Unity Public Health Department in our Discover Muscatine newspaper about testing. And I have our expert here with me today, Miss Jamie McLean. And so, talk to us a little bit about what your position is so they know who you are at Public Health. And then we'll kind of get into this special project that you guys are working on to hit this testing in our county and make sure that people are getting taken care of and staying healthy.
Yeah. So again, my name is Jamie McLean, and I am one of the adolescent sexual health educators at Trinity Muscatine Public Health. And so my whole job is basically getting information out to people so they know exactly what resources they have, specifically around sexual health, sure, but honestly, any health concerns, we are happy to assist with that. And so having this advertising out there for the services we provide at Public Health is just so exciting. I am really happy to have that.
Yeah, when they called and talked about putting the advertising out and how they really wanted to hit our county and get the word out about the services that you guys are providing, I was excited because it is hard to know sometimes when you're dealing with a specific issue who to reach out to, what that resource is, and where to go. And, because we're lucky because we have so many great resources in Muscatine, but sometimes it's like, okay, wait a second. I know I saw something on that, but who was it that was providing this service? And so it's nice to have you on the show to kind of specifically talk about this subject, but I am excited to hear that you'll come back and chat with us about other things that you guys do at Public Health too. So today, we're specifically talking about HIV and STD testing that you guys are doing right now, you have a grant for that. Is that correct? That is kind of helping pay for some of those services for people?
Right. This is actually, the advertising is a great partnership with Scott County Public Health. They had some funds to help us advertise the services that we provide every single day, all the time that we're open. And it is grant funded. We're actually a really special clinic. I won't get into too many details because it's a lot, but we are a Title X clinic, and that means that we have special funds from the government that allows us to provide these services. And the great thing is we can provide them to people regardless if they have insurance or not. They, don't have to prove anything. They can just come in, they can just say, hey, I need services. We work with them. We get that service to them. They don't have to have ever seen us before, which is really great. So we will serve anyone.
That's super cool to know. So there's no specific guidelines as far as like income level, or do you have insurance? Don't you have insurance? You can only have this type of insurance. It's very clear. They will help anyone.
Yes.
Which is amazing.
Yeah.
So talk to me a little bit about like location, because I told you there's so many services, so many places in town. And if nobody's been there before, if they're wanting these services, where would they go to get this help?
Yeah, no, that's a great question. And we are right next to the hospital, but we are not in the hospital or where like some of those other primary care providers are. We're actually building outside on the corner. The address is 1609 Cedar Street.
Yep. And
we're just right at the top of a little hill.
Yep.
It says public health in nice big letters. And that's where we are. That's where our clinic space is.
Yep.
So
the clinic is awesome. I will tell you from experience that all of the staff there is amazing and great, and you will feel super welcome as soon as you walk in the door. I'm not just saying that because I used to work at UnityPoint, but going there for services too. It's nice to have that like homey feel, that you don't feel like an outcast when you don't know where you're going. Somebody's going to be there to help you and let you know exactly where to go, and kind of help you through the process right away if it's your first time. So that's always good to know when you're going somewhere for the first time, is these people are friendly, they're excited to help you. And so let's talk a little bit more specifically about these services that we've been, like I said, we've had in the newspaper for the last several weeks, and we'll continue to have that. If you're looking for an address or specific information on this that we're talking about today, it'll be in this week's edition of Discover Muscatine as well, so they can find that information. But what exactly is the testing that you guys are doing right now that we're talking about today?
Right. So we provide HIV and STD or STI testing. Those terms are often interchangeable. So if you hear them both, don't worry about it. It's the same stuff. And basically, these are just infections, either viruses or bacteria, that are most commonly transmitted through sexual contact. Not always, but most commonly. And it's so important for people to get tested because if left untreated, they can do some serious damage to the body. And they're actually really common. Statistics show about half of all sexually active adults have had an STI at some point in their life. And the only way people know for sure if they have it is to get tested. And then once they get tested, they can get treatment, which is something we can also provide or connect them with.
Sure. And it's not something that, I don't know, I feel like years ago it was like, you don't talk about that. You don't talk about going to get tested. But now I think we're trying to make it something that's a little bit more comfortable. I mean, obviously it's not like something you want to shout from rooftops and just talk to, complete strangers about all the time, but it is more common. Right. Unless you're Jamie, then she's going to actually go to our rooftop today and shout about the services they're going to provide. No, okay, she's not going to shout at you. But yeah, we're trying to make it easier for people to talk about, easier for them to come into a place like public health and let them know, like, this is what I'm dealing with, this is what I want to be tested for, and not be ashamed or, worry about talking about that.
Absolutely. And you're right. There is a lot of stigma and certainly discomfort with the topic. And those are normal feelings that people can have. But I want to always, and that's why we're really excited to be able to be here and talk about it, because there's nothing wrong with either having or have had like an STI at some point. It is a part of life. People can get them just like you can get the flu.
Yep.
Like, it happens. And the thing that we really want is for people to know how they can avoid them. Just like, flu season comes, you wash your hands and you cover your coughs and sneezes. Same deal with sexual health. We want people to know what they can do to prevent, know what to do like in getting testing so they know if they have it or not, and then how to get treatment. And if we don't provide the treatment at public health, we will get them connected. We just don't test someone, say, oh, you have this, and send them on their way.
Like, see you later. Like,
no,
figure that out.
No, we are with you every step of the way to make sure that whether it's positive, negative, whatever your concerns are, we get that need met.
Sure.
And no judgment ever.
Yep, that's awesome.
Yeah.
So I know people are wondering, so like especially a younger person who maybe has never been tested for something like this before, what kind of testing are we talking about? Is like a mouth swab? Is it blood work? Does it depend on what you're, wanting to get tested for that day? Talk to me a little bit about that.
That is a super great question. I'm so glad you asked that because depending on what and where we're testing, we're going to need to use some different things. So what you most commonly hear about is for HIV, for example, super awesome. It's a really rapid test. You will know within like 20 minutes.
Oh, wow.
It's just a little finger prick. Like, have you ever donated blood? Just a little finger prick. We put on a little swab and we find out
pretty much immediately.
Yeah. It's very quick.
Yep.
For some things like syphilis, for example, is actually a more common STI now. It's rising in the number of people who get it and can be
in our area or like
in Iowa.
Okay.
In Iowa, but across the nation too, we're seeing more cases than before. And that is a bit more blood. So it's a little bit of a blood draw. Again, if you've ever had blood work before, for chlamydia, gonorrhea, like it's just a swab of the area or a pee sample. So, and we try to make it super easy. We even have a private patient bathroom. If someone's like, I don't really want the nurse to swab, I would rather do it myself. No problem.
Yep.
You can do that.
You do you. Whatever makes you comfortable.
Yeah. And again, everything's private. Like if I'm in the office or whatever and I'm working with a patient, whatever we're talking about, it's between us. It's protected.
Yep.
So it's not, I'm never going to go anywhere else.
It's the same as if you go to your regular doctor. That you can't go spread that around town. You can't talk to your friends about it.
No.
It's definitely a private session with a healthcare provider that is not going to be shouting your business about.
Absolutely.
The important thing is, like you said before, is that people know so that they can be treated and so that it doesn't get worse, because that can happen with pretty much everything that we're talking about.
Yeah.
Is if you don't find out, if you don't know, it just can continue to get worse.
Right, exactly. And some of them, while they might not be deadly or considered deadly, they can still cause permanent damage to the body. And even after we cure it, we might not be able to fix that damage. And so we want to catch that stuff early, get it taken care of. And in cases where, like HIV, we cannot cure HIV yet, but people live long, healthy, active lives with HIV as long as they get tested, because then they can get their medication, they can work with a doctor, and they can continue on with their business, right?
Yeah.
But that can only happen if they come in and get that little finger poke. Yeah. That's the start of it. And we know it's scary sometimes, like anytime you find out that you have any condition, any infection, any disease, and we're here to work with people on that. It is our livelihood to work with folks and make sure that you are connected to whatever services you need, no matter what.
Yeah, and that's so awesome to have people. And again, I can attest that everyone at Public Health is there for a reason, is there to truly help the community and make sure people have the services they need. I mean, that is literally what your job is. And so it's cool to know that you're going to go in there, you're going to be tested from start to finish, regardless of what those results are, whether they're positive or negative. They're going to help you through what the next steps are or how to continue to prevent so that you don't ever get a positive test, all of those things. And so that's a good feeling to know when you're walking in. So we talked about the location and where they need to come if they want to be tested. What about, are there specific days that they can come so that they can get this free test? Is it Monday through Friday? What are the hours and the days that people can come in to get these types of tests done?
Yeah, no, that's a great question. And our business hours are from, I believe it is 8 to 4:30 on most days. We ask right now, especially, that people go ahead and give us a call ahead of time to schedule an appointment. That way we have everything ready to go for you. We can ask you some questions ahead of time. And basically we'll work with people as best we can, right? Because we know people have school, work, commitments, and we want to make sure that they're able to get in. So our patient service representatives are absolutely amazing people, and they work really hard to make sure everyone's scheduled in at a time that is going to work for them,
Yep.
and that they have enough time with our healthcare provider to get all their questions answered,
Yeah.
get the test done, because it's not just go in, get a test, leave. Our healthcare
Right.
provider wants to talk with you and find out, hey, what else do you need? What can we provide for you?
Yep.
So our staff just really do a lot of work and a lot of really excellent work making sure that this service is as accessible as possible.
Yep.
So, yeah.
Yeah, accessibility is so important, especially with younger folks. You know, you want to make sure that it's easy for them to call and contact you and get in for these tests and kind of have access to that information too. So, like we were talking about before we went live today, you know, things are so different in the school system. Your job has even changed, you know, how you're delivering information to the young folks in our community. Because, you know, you can't just walk into a school and sit down with a group of kids anymore. It's a lot different. So making sure that we're doing things like being on the show today, that's awesome. You know, making sure we're getting out the information any way we can, whether it's the newspaper or the show or shouting from the rooftops.
If you let me up there, I will.
We can talk about that after the show. But what about they don't need any referrals to come do any of the tests. It's just specifically they want or need this test done. So you don't have to have your doctor saying, you know, this is the test they need. It's just you want to provide the service. You will help them through the process afterwards, whether it's positive or negative. Awesome. So all these things seem so easy. They have the education too. I love just, I don't know, you have so many people within the office that specialize in different public health pieces. So regardless of whether it's your specialty or not, if you don't know the answer, there's so many other people in the clinic that specialize in that and can help you through the process. That's an awesome thing that we have in our community through public health, for sure.
Yeah, no, I agree. And we also have that partnership with other healthcare providers outside the agency too. CHC is a recent one that has come in, which is also great because they provide very accessible services. So just like you said, if I can't help, if my colleague is like, I think I know a better resource, we will get you connected. That public health always tries to strive to be that point in the community where we're connected to a lot of different resources so we can guide our patients and our community to whatever's going to suit them best.
Right. Yep. So we talked about where they go. We talked about when they can go. What about the ages of people that can go? Who can go? So do you have to be a specific age to come without a parent? If we have a young, someone watching that's a little younger today, but they don't want to talk to their parents about this, but they want to get tested. What does that look like? Because I don't really even know what the age is and if you have to have parental consent to do this stuff. What's that look like?
Yeah, no, that's a really great question. And it's actually really specific to our clinic because most doctors' offices, if you are a minor, you will need parental permission for services. The Title X designation we get from the government is a bit different because we know that, especially for younger folks, if they don't feel that they have a trusted adult to work with them on this, they might not get those services. And we already know that sexually transmitted infections, HIV, can be really damaging or even deadly. And so because of the Title X designation, we don't want that to be a barrier. So at our clinic, anyone 12 years old and up can come in. They do not need parental permission. There is occasionally an exception if someone gets a positive result, HIV, for example, because they're going to need an adult to help them get medication and treatment. That is the only time, and that's only for a positive. And that is explained before they even get tested. So they get to choose. But everything else, they can come in, and it gives our, sometimes people are like, 12, that's so young. And yes, it is young. But if a 12-year-old's coming into our clinic because they're worried about an STI infection, that's a warning sign for our very well-trained staff to say, hey, something's going on, and work with that youth to make sure that they are safe. And so it's a really, really great tool to make sure not only are they getting their physical health taken care of, but we're also making sure that all other aspects of their health and well-being are being looked after too.
Yeah, that makes so much sense. I mean, years ago, it would have been like, holy cow, 12, they shouldn't be able to see a provider without an adult. Well, that's just not the reality of today's world. We want them to have whatever services that they need and not feel uncomfortable. Maybe they don't have, I mean, everybody doesn't have a good relationship with the parent. Some people don't have two parents in the home. Maybe the other parent's busy. There's so many different scenarios where just getting that kid to open up and come to, public health of all places, like that's where I'd want my kid to go for that type of help. And then you guys can help guide them as, like you said, trained professionals that know signs and know how to help individuals, especially those youngsters that we want them to be coming in. We want them to trust you. We want them to get that information because I imagine, I'm not a doctor, but if it happened at 12 and they have a positive test, if they waited until they were 18 or whatever that age used to be to get tested because they didn't want to talk to their parent, I mean, by then, who knows how far how advanced that could be, and all the things that you probably could have done to help them kind of prevent some of that stuff. So awesome. So anyone 12 or older can come in, no questions asked. You don't have to have insurance. If you have insurance, but you're, 13 and you don't have your insurance card or whatever, it doesn't matter. Insurance or no insurance, come in, get tested. That's the only way that these folks can help you is through coming in and making that first step to get the help. I know the other thing that I used to think was really cool is just the resources you provide as far as like protection for people and things like that. So maybe that's the start of the talk is they're just like, well, I need some protection. And I don't know. I mean, I'm sure that's kind of how it starts is they kind of trust you a little bit and then they're willing to come get tests done. And
Right.
And that's how you kind of build those relationships in the community with some of the young people.
Absolutely. And those are totally conversations that all of my colleagues end up having with patients, right? And even when people are in our clinic too, our healthcare practitioners, our nurses will talk to them and be like, hey, if this is a concern for you, do you know or have access on how to use condoms correctly? Because that is a great way to prevent the spread of HIV and STIs.
Sure.
When they're used correctly. And a lot of people don't know because it seems so easy, but there's a couple things that can happen that can make that protection not work as well. Same deal with birth control. Sometimes people come in and they're like, yeah, I came in for this thing, but you seem pretty cool. I have a question about this too. And that's our whole goal, right? Is that we want to build that trust, build that relationship, because it can be intimidating going into a new place, having to talk about such personal information. And we do ask people, be very honest with the questions that are asked of you, because that helps our healthcare providers know how to help you best. We probably won't test you for every single STI under the sun when you come in. Because that might just be a waste of time.
Right.
We don't want to put you through more tests than you need. So we'll ask really, really personal questions, again, just between you and the provider. But be honest, because that's going to help them zero in like, aha, let's test you for this.
Right.
So that way you get the right medical care.
Sure. And that's important always to talk the truth with your provider, whichever situation you might be in, whether you're with your, everyday provider that you see on a regular basis or whether you're going to public health. That honesty is definitely the key to getting the right help, like you said. So be honest when you go in there.
So we've heard it all before.
I'm sure.
We've heard it all before. You will not surprise us.
This is not the first time they've heard whatever you have to say. I'm sure.
If you're wondering it, I guarantee a bunch of other people have wondered it before you and wanted to know. So it's great questions to ask.
I'm so glad that you came to talk about this stuff. Like I said, it's stuff that in the past we haven't wanted to talk about, just openly. And now that we can, and now that it's so important that we do and that we show the younger generations that it's okay, to talk about it and to get the help that you need. So I was excited, like I said, when they called and wanted to place the advertisement. I'm like, I want to know more. So I'm sure the people at home who are watching want to know more too. And if, one young person watches the show today and comes to get help, that's worth it for sure. For you to come down here and be on the show today. There are so many services that public health provides, and I'm going to definitely ask you on the show more often so that you can come and talk, or the other people at public health can come and talk about those things, because our health is so important. And I hope that people watch today or see the newspaper when it comes out this week and take advantage of the services that we have in the community, because that's how we continue to offer more services and how these things kind of to grow.
Absolutely. And I would even extend that a little bit to even for adults
Mhm.
who are seeing this. If you
Yeah.
have youth in your life, I mean, you care about them. And
Of course.
adults, especially parents, caregivers, have the most impact
Mhm.
on their youth. And being that trusted, askable adult
Yep.
can be a huge difference in that youth. If that youth says, I really need help with this, and you are that trusted adult who's like, okay, but I will help you.
Figure
Even
it
if you
out.
don't know the answers.
Yep.
Totally fine if you don't know the answers. Give us a call.
Yep.
But that can be a huge,
Life
huge difference.
changing when you have somebody
Absolutely.
that you can trust to talk about stuff that's personal and sometimes uncomfortable. But when you have somebody that you can talk to, whether it's a parent or another trusted adult in your life, like an aunt or whatever,
Yeah. Yeah.
that is super important. I totally agree with that. So I really hope that things continue to kind of calm down and you can get back into the schools, because I know that that's such an important service that you guys provide with educating our young adults and our youth about all of the services, all the ways that they can keep themselves safe. So thank you for coming today. And like I said, you can come shout from our rooftop anytime that you want. Anytime you have something to chat about, I would be happy to be that I guess way for you to get out to the community even more. I appreciate you coming. Yeah, thanks. Thank you guys for joining. I hope you guys learned something today. I know that I did, and I'm sure that some other viewers have learned about some services maybe that they didn't know that our public health provided. But I swear, you guys, there's so many services that you can get within that building. It's just insane, the amount of resources that they have. So I hope that you will take advantage of that. Give them a call, set up an appointment, and have a trusted person that you can talk to about pretty much anything. And that's so important. And it's such a great community service that we have right here in Muscatine. If you need more information, we will make sure to tag their Facebook page, their social media outlets, so that maybe that's a way that you're comfortable chatting with someone. Also, like I said, in this week's edition and for the next several weeks, there will be that ad that kind of tells you how to get this specific service, and we'll have the address and phone number and all of that stuff that you'll need to get a hold of these amazing people at our public health right here in Muscatine. We appreciate you joining us today, and look forward to seeing you again in the coming days on Afternoons with Ashley. And remember, until next time, that kindness is free. So spread that stuff wherever you go. Have a great day.